tested positive for COVID. Were you sick? I'm so sorry. Okay, everybody, I just want to say welcome. I'm so glad you're all here. My name is Kirsten Karchmer. I was a board-certified reproductive acupuncturist for almost 2 decades. I had the pleasure of working with well over 10,000 infertile women who are dealing with getting pregnant and staying pregnant, and happy to be here tonight answering fertility questions about everything around getting pregnant, staying pregnant, about how do we identify what the underlying causes and miscarriage problems are, how does it relate to PCOS, to endometriosis, to advanced maternal age, to hormone testing, to whatever's going on. Please make use of this time to ask whatever questions might be helpful to you on your journey. Maybe you're not even trying to get pregnant. Actually, this is my favorite question. Like, what do I need to do to get ready to get pregnant so that once you start, you don't have to take as long as some other people might. So the first question of the day, actually, Megan said, what is the biggest cause of infertility? And I think that there's a few different reasons. I think first of all, women are really, and people with uteri, we're expected to sort of do everything. We're like, need to be fit. We need to have good jobs. We need to bring in the money. We need to do all the housework. We shouldn't bother our mates too much. And we work really, really hard. We do that especially because it's like, what's the standard for beauty for us is like too thin, too much exercise, not enough food. And so what happens is it's really affecting our health. So the majority of women that I work with in my program, thank you for those likes, because I agree, the majority of women that are in my program are like, look, they're underweight or they're overweight. They don't have any energy. They can't restore their energy. They don't have the strategies to be effective doing that. They don't have any menstrual blood, or they have too much blood. They have a lot of cramping, a lot of PMS, all indicators that we know are overall indicators that the body is not functioning optimally. So then they go to the doctor and the doctor says, okay, well, you have a bad period. That's okay. We'll just put you on birth control. And then when you're on birth control pills, then it stops ovulation. They'll say, well, it regulated my period, but it actually hasn't regulated your period at all. What it did is it just stopped ovulation. When you stop ovulation, now suddenly you only are not having periods, you're just having breakthrough bleeding. We lose all those signals that are clearly defined in the peer-reviewed data that are predictors of natural fertility. And so that goes on for 10 years. And then after that, they get off birth control and they're like, I'm ready to have a baby. I used to have a really regular period when I was on birth control. And then there's a complete shitstorm going on. And then that shitstorm tells us like, oh no, like there's no blood, lots of clotting, heavy bleeding, whatever the problems are. So then we have a lot of work to do, but in our culture, we don't have the mind frame of like, let's try to figure out at the foundation, what are the problems and fix those so that all of those other symptoms go away naturally. So that was a super long introductory question and answer. Please join in either in the chat if you're on and ask your questions. Okay, let's see. Oops, sorry. Should you go to the hospital after a miscarriage? If you're having a miscarriage, the first thing you want to do is call your doctor. So they will know based on your symptoms, your exact presentation, and your clinical history. All of those, it will never hurt to be in communication with your physician. So Brandy, you got tested for COVID today. I'm sorry. What I was asking you before, what symptoms do you have, baby? Thank you for all those likes. So just, on the platform, like whenever you hit the like button, that tells TikTok essentially and all the other platforms, like the conversation that we're having is important and to share it with more people. So when you hit the like button, plus it tells me that what I'm saying is useful or interesting to you as well. So that's more interesting for all of us. Becca, hi baby. Short cycle, 21 to 26 days. Luteal phase is 7 to 10 days. How do I lengthen it? So the trick is always, for whatever the problem is, short cycle, long cycle, hemorrhagic bleeding, too much PMS, low energy, there's never one fix for each of those things. The reality is because you have a unique presentation, how your body is responding to how you eat, how you sleep, how you exercise, where you live, what kind of chemicals are in your house, what kind of chemicals you put in your body, how you move your body. And so I don't know why your cycle is so short. I would have to do my detective work to try to figure out, like, what's the deal? Why are your cycles too short? I don't care about the cycles being short. That's the side effect. I want to figure out at the foundation. The first question that I always ask is like, what is your energy on a 1 to 10 without any caffeine or exercise for like a few days. And don't be generous, right? Because what I would say is like a 10, almost nobody has. Like the Buddha has 10, right? 9 is pretty freaking good, but that is not manic. A 9 at 10 o'clock or at 9:30 is ready to go to bed. A false 9 is like, yeah, and then I start ramping up, like I'm energetic through the day, and then I start ramping up. That person is going to be sort of overheated. They're going to have a lot of red on their tongue. If you haven't been to the link in my bio, take the quiz, What My Tongue Tells Me. Super interesting, because like if you look at my tongue, you can see like I have a lot of digestive issues. In fact, something really is weird with my digestion. My tongue is swollen, it's pale, there's a thick coating on it. I'll show you again. It should be red like meat, and it should be shaped like the letter U. And so when we don't have that, we can figure out a lot of the problems that are happening with digestion without doing labs or blood tests or anything invasive. So it's really useful. So you can do that in the link in my bio for free. It's kind of fun. It has pictures to match up. Is it normal for DHEA to give you nausea? Started 3 days ago and have a lot of nausea. It can. I mean, it's a precursor to testosterone, and if you're sensitive to testosterone, it could just be like how it's delivered. I would stop taking it for 3 days and see if it changes. And are you taking it with food? Also, that could be another hack that you could do. Thank you so much for the likes. Sincerely appreciate it. Miss Gulata. Day 2 of me eating kanji to start my day. Congratulations. What do you think? How does it taste, and what's your reaction? You like it? Okay, good. Are you pureeing it? That's the most important part. Puree, puree, puree. Okay, CM. Let's look at the comments. Period is 2 days of bleeding, red blood, wet spotting. All sonograms are normal, trying 10 months. So 2 days of bleeding. Chinese medicine is, remember, I was a reproductive acupuncturist for 20 years. Chinese medicine is not Western medicine. They come at every problem completely different. I was trained as a Western doctor, although I never practiced Western medicine. I was a Chinese medicine practitioner. In Western medicine, we're looking for a disease. So you go to your doctor and you're like, I only have 2 days of bleeding. They're like, that's not a disease, you're fine. You go to an acupuncturist and you're like, I have 2 days of bleeding. And we know that the data are clear, and from Chinese medicine too, that optimally you have 4 days of bleeding, soaking a tampon or a pad every 4 hours. And so what happens is like, okay, well, it's not a disease, but something's not working in terms of the quality of food isn't enough. You're over-exercising, you're under-exercising. Like what you're eating, maybe not the quality is bad, but it's like the type of foods that you're eating don't work for you. You're not exercising, and we did exercise, you're not sleeping enough, or the quality of sleep isn't good. You don't know how to restore your body, or the mechanism by which you take food and break it down and turn it into energy is compromised. If you can't do that, then if you can't extract the nutrients out of steak, you can't get the iron to make marrow, to make blood, to make a uterine lining, to make a place for your baby to implant, to make a placenta, to feed your baby, because basically your blood feeds your baby. That's the source of nutrients for your developing baby. So if that's compromised, everything, the cascade is enormous because of that. Does that make sense? Like, hit the like button if that makes sense. It's hard because we're going to start live casting in an app on the website. So I'm trying to find easier ways for us to actually have more direct communication. Okay. Catherine, thank you so much for the mic, baby. How often do I help cystic fibrosis? I only helped about 3 people with cystic fibrosis in my whole life. Not a lot. I try to be super, super transparent with you. With liver disease and getting pregnant, can you tell me a little bit more about like what liver disease and what your doctor says first? Okay, just what does Clomid do? Hello, Em. I swear every time you do this, I like want to go to the costume store and go get my hat. Next time I'm going to have it for you. How heavy should implantation bleeding be? It's not heavy. It's a few drops of pink blood. What does Clomid do? That's such a good question. I'm just scrolling back to see the comments. So if I'm just like, looks like I'm fooling around. So glad to see so many. Again, if you haven't been to take the quiz, What My Tongue Tells You About Your Fertility, I find it to be super insightful. My goal is to teach you that ultimately of us, having the opportunity to talk, meet with each other, work with each other, that over a couple of months, you learn your body and you're like, oh, that means this for me. And that means this for me. And that means this for me, and if it's your best friend, it won't mean the same thing. But so that then you get everything fixed up and life happens like Brandy, you get COVID and you'll kind of like fall back a little bit. You're like, I know what my body needs to get back to optimal. Okay, wow, still trying to get to the beginning of the questions. 250 questions here in line. So I'm gonna try to be very efficient, but I am long-winded. That's just my reality. Sure, that's okay. Gosh, dang. How can you work with me? There's 3 ways you can work with me. One, you can just come and learn from the lives. Free content every single night of the week, every weekend. Unless I'm sick, if I'm not here, I'm probably sick. That's the easy free one. 2, you can take the quiz. What my tongue to, that's the place just talking about the things that I'm talking about every single day. 3, you can do a conceivable report. So I was, in my clinic for 20 years, I saw 250 fertility patients a week. What I realized is that what we're doing wrong in fertility treatments is we're chasing symptoms like short cycle, long cycle, anovulation, high FSH. But the reality is that if we can identify all of the underlying factors and how those factors are related to each other and come up with very personalized treatments for those or interventions for those as a system, not like one-to-one, it's like, how does the whole system fit together? Then we can produce exponential changes in people's ability to get and stay pregnant. So in the conceivable pilot, we had 105 women in our pilot who were diagnosed infertile. We did a scoring tool that we use at Conceivable to predict the likelihood of natural conception. We want to see, does this scoring tool actually predict the likelihood of conception? What we found was that actually the starting score of the women who couldn't get pregnant was 33. When their score got above 60, they increased the likelihood of natural conception by between 150 and 260% in 4 months. Now, you have to remember, like, one IUI increases the likelihood of conception by between 11 and 13%. Like, enormous change. And the side effects were they slept better, they ate more vegetables, they drank more water, their PMS went away, their cramping went away, their energy levels went better, and so on and so on. And so, so the second way is you can order a conceivable report. This is very, very affordable. That's the whole purpose, is to provide something very affordable so that every single person who comes here can afford this. If you can't, reach out to me and I'll talk to you about it. But it is the price, if you live in the US, the cost of 1 month of diapers. If people do not make a small investment, they don't do the recommendations. So the conceivable report consists of the score, then the assessment. What are all the factors that are keeping you from getting or staying pregnant as a system? And then I go through and make you a very detailed report saying, these are the issues. This is exactly what I want you to do to start to improve this. Then I go and I make you a personal video. And I'm like, hello, Kelly, it's me. This is what's going on. This is how this is related to this. And this is how it's related to this. And when we start to fix the system, will start to work exponentially better. Then, if you like that, the easiest thing to do is you can start working with me monthly, because it's better if we do it that way, because you want to do it and then you can do another report, or you can be in the conceivable program. It's about the same price, but you get a consultation with me if you're in the program. You can do one-on-one consulting with me, but the reality is one-on-one consulting is super expensive for you because it's not my most effective way to help you. Back to your questions. That was a long answer. My doctor gave me a new due date 3 weeks after what it would be. It's because it's hard to predict. Even though, hi, Laura Marie, even though you'll be like, I only had sex on April 1st. That is the day I conceived. I don't know. I don't understand it, to be honest. Raquel, is there any research that COVID vaccine causes fertility issues? None. None. In fact, they keep doing study after study after study to try and see, is there any impact? There's a lot bigger impact of like long-term health for the children from IVF. Still, like, we know that there's some impact for the immunity and some other factors around doing IVF, but so far we haven't seen any data. What we do know is that getting COVID is probably going to be very hard on your fertility, because especially if you're a long COVIDer, it looks like chronic fatigue syndrome. That's most certainly going to affect your fertility. I'm Colt's mom. Baby. I'm a basket case here. I'm sorry. Last week, plus blood test, they took my IUD out and they think you're 5 weeks. Oh my gosh. They took your IUD out and like you were already pregnant from your IUD? Like, explain, baby. Tell me more. You got my first McKenna injection. I do not know what McKenna is. I don't know if that's a typo. Megan, can you have an AMH of 10 and a low ovarian reserve and not know it? No, AMH is high. People often with people with PCOS, and so if your AMH is high, you have a high ovarian reserve, but like a pathologically high number of follicles. Oh shoot, Looks like we got lost our connection there. Ashley, no, Ash, the cat. Does the threat, this is a great question, does the threat of miscarriage go down each week during the trimester? No. Up to 12 weeks, it's pretty equal, right? We just know there's like, this is where the cells are dividing and replicating like crazy. If that doesn't happen perfectly, then often you'll have a miscarriage. Now, the trick is that we know that a lot of those replication and duplication errors come from epigenetic problems, which means epigenetic style, behavioral health, mental health, and like environmental exposure all impact the turning on and turning off of genes. So if we can go in and find out like what are all those factors, start fixing them, ultimately I'm going to prove that that's true with enough numbers because that's my hypothesis. Baz, what happens if I miss my period for a few months and then it just came this month? Could I try? It means that something's going on. If you're not having regular periods, it tells us that like blood sugar is probably out of whack, that there's some like metabolic thing potentially going on. There's a whole bunch of different things that could be going on, but you know, it's definitely like suboptimal state for fertility. Kylie, can IUD be successful even if one has a complete, you mean, oh, IUI be successful if you have a closed tube? Yeah, sure, because that one tube is open. Carly, my doctor gave you oh, we did that one. Spotting at 3 days DPO and 11 days DPO. So the 3 days DPO may have been like later ovulation. 10 days, 11 days DPO could be implantation for sure. Okay, Aaron, when should you try not to fly being pregnant? That is a good question for your physician who knows your whole clinical history because it can vary. Aaron, I'm 40 with PCOS, normal periods, that's wonderful. Miscarriage in 2015, deal with histamine intolerance, help to get pregnant. So we have some things. So if you're 40 years old, right, we're starting to like really have decline in natural fertility. That does not mean that you can't get pregnant, but what it does mean is we need to optimize the hell out of everything so that we work against the factor like over 40 or at 40 and the factor of PCOS. What else can we optimize? So I would make sure that we had a semen analysis because 30% of fertility is caused by male factor. I would want to have cycle day 3 labs to just see what is your AMH and FSH so that we can optimize around that. And then a conceivable report so that we can look at like, what are the factors that we can control? Like if your egg count is low, there's some things we can do, but not a lot that you can do. But if you only have 1 day of bleeding, that means you're not going to make enough line to make a healthy pregnancy. If you have a lot of clotting, if you have really irregular cycles, all of that can be dramatically improved. You know, just having a short cycle decreases the chance of getting pregnant by more than 50%. Like we'd want to fix that, right? So that we can really optimize around that. After Haley, after stopping birth control, is it normal to have irregular periods? It's common, but it's not normal. We can correct that if we start figuring out what's at the root of it. Yes, if you need my help, you can go to the profile link and look at the conceivable report. What do you know about hyperprolactinemia and fertility? It means you have elevated prolactin. It's often caused by a pituitary tumor. Usually your doctor will do a CAT scan to confirm that, and they can treat it with medication very effectively. Ms. Gulata had an antral follicle count of 8.5 at 35. Is POF, that's interesting. What's your FSH, Ms. Gulata? See, your antral follicle count was high. What was your AMH? Because the antral follicle count and AMH are different. So AMH and FSH. Carly, off the NuvaRing and can't seem to get pregnant. So it's important to remember when you're taking any kind of like hormonal birth control that you are not actually having a period. So people say, my periods were completely normal and then I got off it and then they got really crazy. That's the real state of what your body can do. So if you really want, like what I would do is I would want you to do the assessment. I would want to look at like 100 different factors, how those factors intersect with each other and how they relate to your diet, lifestyle, behavioral environment, and then start to try to fix those so that we can get you, because it's really hard to get pregnant if we can't get your cycle regulated. Amanda, I struggle with really long bleeds, huge clots, 47 now of straight bleeding. And are you still having clotting? Clotting, like there's no data on this, but in my clinical experience, I saw that clotting was a really enormous problem with fertility. And the reason is that there's a lot of clotting. The clotting is in your lining also, which can impact implantation. Plus, the um, questions. Sorry, I got distracted. Plus, what you want to do is you want to get rid of the clotting, and then you want to make sure to have the ability to like clean up the lining. But once we get rid of the clotting, probably that straight bleeding would stop. I'm sure you've been to your doctor. You definitely want to talk to your doctor about ruling out fibroids or endometriosis, but at the same time, you could still be working on it using Chinese herbs. So you could do that from the link in my bio, the healthy periods for healthy, what do you call it? Healthy fertility. Autumn. Questions about go to, actually I don't own Conceivable Herbs anymore, and so you can go to 5 Flavors Herbs and they'll take care of all of that for you. Carly, my doc gave you okay, we did that. My spouse's semen analysis came back with low morphology and concentration. Is there any way to increase? So morphology is really hard to fix. There is a urologist in LA. His name is Paul Turek, Turek, and he's incredibly smart. I would first go to his blog. I haven't caught up on it. I need to do that and see like what the new research on morphology is. Concentration you can improve with diet and lifestyle, and there'll be lots of blogs on there for that. Turek, and then depending on what you read, what I would do is definitely like contact him. He does virtual consultations. So smart. If my mate had any problems, I would do whatever it could to get like him taken care of. And I would also be optimizing the heck out of everything for you. I would want to know like what's your AMH, what's your FSH, what's your conceivable report look like, what's your conceivable score, what are the factors in conceivable like factors that we can fix so that we can offset the low morphology as best as possible. You still might need other interventions, but it won't, like it's in your best interest to try to like optimize across all of those as much as possible. Oh, Brandy, she's got COVID. She said, I feel like I've been hit like a truck, fever, cough, tired. Do you know how you got COVID? And were you vaccinated? Haley, we did that one. Thank you for all these great questions, you guys. Okay, Jay Ramirez. What can help me ovulate since I never get a period without Provera? So you have to remember every single part of your period, your body is raising it like it's a problem. Your body is raising its hand saying, actually, I need some help. So long cycle, irregular cycle, heavy bleeding, cramping, clotting, severe PMS or just any PMS, pain during ovulation, no cervical discharge, all of those things, your body is like such a magnificent tool that tells us like what is working and what is not working. And so when you're not getting a period without Provera, something is super out of whack. And so you can continue to use Provera, but you're missing the point that like your body's like, however things are going on the outside, diet, lifestyle, behavior, physical problems is not working for me. And so I'm going to just not have a period. So I can try to help you to figure that out from a conceivable report. That's, a third of my practice over the last 20 years was PCOS. So, it isn't hard. It just takes some specific, detective work. The research is abundantly clear that the most effective treatment for PCOS is a combination of diet, personalized diet, lifestyle, behavioral health, and mental health. So we know that that's, and that is in my opinion, the intervention that will have the biggest impact on preventing the things that anovulation related, especially related to PCOS, they have high risk factors of diabetes, estrogen-dependent cancers, and strokes. We want to try to reduce that risk as much as possible, and you'll feel better. Semas, I have an IUD and have been on hormonal birth control for 10 years. My period is 2 days. No, if you're currently on birth control, you don't have a period. That's not a real period. That's like a breakthrough bleed. So we don't know what it is. We won't know what your real period is until you actually are like, because when you're on hormonal birth control or the NuvaRing or whatever, its whole job is to stop ovulation. That's how it prevents you from getting pregnant. And so when you stop ovulation, you're not having a period. So it's really hard. We're not getting that feedback mechanism that I was just talking about. Amanda, because my cycles are irregular, I wonder if that's going to be harder for us. Yes, it will be harder. The research is very clear that like having an irregular cycle decreases likelihood of conception by more than 50%, because your body's like, it's dysregulated, right? The whole system is dysregulated, but it's not 100% correctable, but you can make it exponentially better. I just had a woman in my program. She's like, I'm 39 years old and I have not had a pregnant on my period on my own in 3 years, and I had a period today, and she's super lean, super lean. She exercises like way too much, so it's like hardly any fat on her body, which makes it really hard to get a period back, and she did. So I was really happy about that. Yes, you can get help from me. The easiest way is to do your conceivable report from the link in my bio. So we did that. Halsey, I feel so stuck because I want to get off the pill so bad, but I don't want to get pregnant yet. Yes, that is a problem. You could, here's one option, depending on, like what your clinical presentation is, you would talk to your doctor about this, of course, but you could get off the pill and then fix the problems while you're doing that, use a non-hormonal IUD. But if you're like going to start getting pregnant, now is the time, before you start trying to get pregnant, now is the time to start planning for conception. That way, because when people are like, okay, I'm going to start trying, then every month they don't get pregnant, they're freaking out and suffering a lot. And I don't want that for you or anyone. I hate to see so many of you guys not having periods. Catherine, taking progesterone to start my period every month. Okay, so something, Catherine, so something's going on. I don't know what that is without looking at everything, but something's going on why you're not having a period on your own. And so if you have to have progesterone to start a period, it is very unlikely that you're actually ovulating at all. So we would need to go in and figure that whole system out. Is there anything to do to increase egg quality for IVF at the age of 25? How do you know you have an egg quality issue, first of all? Yes, there is. So the thing about egg quality that's really fascinating is that you can't, like, you're born with your eggs. You can't really change the quality of eggs, but what you can do is you can change the environment in which they mature. What does that mean? So all of your eggs are in your ovary, but 90 days before that egg is ready to be fertilized, it kind of goes through puberty. We call that follicular maturation. During that time, it's not like protected in the ovary. I mean, it's still in the ovary, but it's not like in this protective sort of seal. So inflammation, diet, chemicals, energy production, like how well you turn food into energy, all impact how that follicle matures. So if we know, like, what are the factors that are going to work against that maturation and fix that, and spend like at least 3 months doing that before the IVF, you can see significant changes. Like when I was working with RMA of Texas as a fertility IVF center, like they would send me all the patients. They're like, this person's had 5 IVFs. They're never getting pregnant. They want to do one more round. They would tell me, like, go see Kirsten and get some voodoo shit. That's what my doctor would say. He would always, and I was like, he's very funny though. We work together a lot now. And like his doctor appreciation, and he's like, hey, he's like, he's from Mexico. He's like, hey, it's Doctor Appreciation Day. Why didn't you get me a present? And I was like, hey, it's Doctor Appreciation Day. Why didn't you get me a present? He's like, because you're not a doctor. And I was like, well, that's funny, because when you're sick, you come to me. And he goes, just because your voodoo shit works really good does not mean that you're a doctor. And I'm like, whatever, no presents for you. Okay, more questions. Hi, Em. 6 days DPO, the highest temp is 97.6, was 97. Okay, so more rest. That's all I can tell you. Like, without looking at everything, like, are you doing everything from your report? It's not fast. Remember that, like, in the best case scenario, like when we're working on things, your temperatures are going to come up on average a 0.5 tenth per month, 1/2 of a point. It's very slow. Can you get pregnant the day before you peak in ovulation? If you do it the day before, the sperm can live and wait. What age do you recommend freezing your eggs? I'm currently 21 and don't plan. Here's the thing about egg freezing. Frozen eggs, they are not as effective as frozen embryos. The younger you freeze them, the better. But the problem is that what I've seen a lot of people do, oh shoot, 21-year-old eggs are really good, but you're going to do a freezing process. They're going to get some, however many, and then they're going to be frozen. But we don't know if they're good or not until we test them in an IVF cycle. So what happens is that, maybe you're 21 now, and then you wait until you're 35 years old because you want to do career stuff or travel or do whatever it is that, is sexy to you. And then what happens is like you have, like, your fertility has really declined. And then you're like, I'm ready to start trying. And like, oh shit, those eggs were no good. Bam. So what I always recommend is before you do egg freezing, do your conceivable report. try to optimize everything for 90 days before you do it so that you can just give yourself the best peace of mind that the eggs that you are freezing, and then start using them at 30 if at all possible. Hi. I will. 5 minutes. Why don't you go turn the water on for the corn for me? Everything else is ready. Thank you. Coleslaw, shrimp cocktail. Sorry, you guys. Coleslaw, shrimp cocktail, and corn on the cob. You dip it in that. Yeah. GFizz, what does Clomid do exactly? Clomid is really amazing. It's very hot, right? So it basically stimulates the ovaries to release 1 or 2 extra follicles. A couple extra, 1 or 2 extra follicles to take. Whit, tell me which, what do you call it? What kind of liver disease you have? Ecuador. Feel like I'm infertile. Can birth control cause? Birth control does not cause infertility. Tell me why you think you might be infertile. And one way to know, like, just not if you're fertile or infertile, but you can find out where you are in the continuum. I always say, like, people aren't fertile or infertile. They're more or less fertile. So what does that mean? That means that, like, on a continuum of 1 to 100, this being very fertile, this being like 0 fertility, not getting pregnant, like in our work, we found that like a score around 30 means probably not getting pregnant, and a score around 60 or above means high likelihood of getting pregnant. So we can use that scoring tool to loosely, it's not like a perfect, like for sure you're getting pregnant or not, but you can be like, whoa, I'm way down in the 20s. I need to do some work to fix that, raise my score. You do such great work. Thank you. I watch a lot. Thank you so much. Well, soon you guys can join the community. It's going to be so good on the website. So we'll have a new website soon. So I'm really excited about that. But thank you for the sweet words. I do really appreciate it. One small step for man. I've been on my period for a month. Okay, do you have clotting? Yes, just a quick introduction. Those of you who don't know me, I'm Kirsten Karchmer. I was a board-certified reproductive acupuncturist for over 20 years. We worked with 10,000 infertile couples and basically pioneered a way to help people to identify the real underlying problems, why you're not getting and staying pregnant, and help you to customize a plan to fix that in a way that we can measure every single month the progress that you're doing. If you want help, you can do it for free. Take the quiz. What does my tongue tell me about my fertility? That's the first one. 2, you can get your conceivable report. 3, you can do the conceivable program and work with me every single month. Semus, why is my period brown? Well, it could be very scanty. It could be old blood. It can also be that like there's a lot of stagnation, like the blood is not circulating well. JW, only 3 in my whole career for cystic fibrosis. I don't have a ton of experience with it. But again, cystic fibrosis, multiple sclerosis, like on the surface, endometriosis, PCOS, we have these problems. But underneath the surface, we have the root things. Can you make energy? Can you conserve energy? Can you restore energy? Can you make blood? Can you make hormones? Do you make enough energy to regulate blood and energy? Do you make enough energy to mitigate and modulate the immune system? Do you make enough energy to raise the temperatures to produce progesterone? So without working on the cystic fibrosis, when we start working at all of those foundational things, and then all the factors in your life that either make those function better or make them function worse. And that's how I would approach it with you. And that's how I do it with everybody, actually. Okay, a couple more questions because my people are clamoring for some din-din. Della, I have PCOS. Okay, how's it going and what can I help with? Yes, Carrie, I live in the UK. Can I get help from you? You can get help from me if you live anywhere on the planet, as long as you speak English, French, German, or you have a good translator. No, I don't speak German well enough to do a consultation. But actually, I'm building something so cool, but I can't tell yet. Okay, Daylin. Blood work came very low vitamin D and progesterone. Okay, well, your doctor should have prescribed like a very high dose of vitamin D. That needs to be monitored by your doctor because vitamin D can be toxic, meaning the only reason it's toxic, it's a fat-soluble vitamin. So if you take too much vitamin D, your body, it will store it in your body, and too much can be toxic. As long as somebody's running a blood, like labs, like every month or 2, just to make sure it's not getting too high. Low progesterone, my job is then to help you to understand, like I would do a conceivable report. We'll look at like, why aren't the temperatures getting high enough to make enough progesterone? build a plan to fix that. But the vitamin D, you know, people say like, what herbs can I take for fertility? I'm like, none. Well, what can I take for low vitamin D? Vitamin D, that's an easy one. Can Plan B shorten your period? It can if you use it too much, for sure. Y'all, Plan B is not birth control. You should think about Plan B as like, try and save it for like 2 times in your whole life. At Casey, very, very irregular period. How can I ensure period and ovulation? The only way I know how to do it is to like do my plan, like to do like, I do the assessment, I look at all the factors, I figure out how the factors are related to each other, and then I start testing. Like, okay, we should do this thing this week, this month. Let's see what happens to your cycle. You're not going to do what I recommend, and then the next month, oh, I'm pregnant, or even that I had a period. But what should happen is like, the BBT of someone who doesn't have periods it's just a flat line, pretty much looks like this. Then what happens is as it starts, your body starts to heal, it'll start to be like dicka. Oh, it went up a little bit, dicka. And it's like, oh, starting to separate follicular and luteal phase. And then licka, and a little bit more. Oh, I had cervical discharge. Okay, we're getting closer. The next month, dicka, I had cervical discharge and I had a spike. Okay, and then they have a period usually. So that would be the way that I would do that. Okay, seriously, like 2 more questions. I get distracted because y'all's questions are so interesting. Hercules, what does it mean to my I'm going to end with this. What does it mean to my BBTs are all over the place? It means a couple of things. One, these are the things that I would look at. Nothing has a one-to-one relationship. There isn't an answer for everything, but there are a few things to like, as my detective process is like, okay, BBTs are all over the place. Well, on the outside, this could be a lot of stress. This could be from certain chemical exposure. This could be from over-exercise. From the inside, it could be from like poor hormonal regulation. It could be related to blood sugar instability. It could be related to like PCOS. And then a whole bunch of other things on top of that. And so what we want it to be is like pretty flat-lined 97.2 in the follicular phase and then 98.2 in the luteal phase. And so you should just, we just start working on it. You use Chinese herbs to start smoothing out once we figure out what it is. Okay, that was my last question. I'm going to go feed my children. It's been a lovely night hanging out with you guys. Thank you for joining. Thank you for being here. I'm here almost every night, sometime between 5 and 6. I know that like people would like me to be on a regular time, but if you set your notifications, you'll get a notification when I'm live. Please come with your heart. Please come if you need support and love, and definitely bring your questions. If you need help from me, go to my profile link, look at the conceivable score, the conceivable report, the conceivable program, take the quiz, what my tongue's telling me about my fertility. All right, have a great day, and I will see you all tomorrow. Know that you are not alone, and this is becoming a beautiful community of people, so I'm glad you're all here. I'll see you tomorrow. Bye, everybody.